My name is Marisa Jensen, and this is my Pre-Hab Capstone project. My project involves health promotion for preoperative patients in order to avoid or lessen postoperative complications. I implemented a Pre-Hab program for patients having cosmetic or elective surgery to markedly increase patient compliance to postoperative instructions, as well as decrease the amount or severity of postoperative complication. This plan includes a checkoff list of to-dos to start at least 4 weeks before surgery, including informed consent, a walking regimen, vitamin and supplement recommendations, travel recommendations, and personalized nutrition recommendations, as well as recovery time requirements. Then, a week or two before surgery, a focused assessment is performed and all postoperative information is discussed, including handouts that are signed and dated by the patient. Informed consent is collected at this time. Any and all questions regarding surgery or recovery is addressed by myself or the surgeon prior to surgery. Usually we both go over this information. The postoperative caretaker is required to attend this visit. It's usually about an hour long. Here are some examples of the paperwork that I have put together to give to our patients. The first one is given to them at their original consultation, even before they book surgery. The second one is given to them at their preoperative appointment at least 2 weeks before surgery. This gives them information for preparing what they need to have before the surgery, what they need to do before the surgery, as well as some requirements for aftercare and recovery. This first paper is meant to briefly describe some things that they can get started on even if they're not looking at having surgery for a few months. First, begin with walking shoes. We like them to walk to get their cardiovascular, heart, and lungs into the best shape possible. Stopping smoking or vaping also for anesthesia problems, but also with healing, the smoking and vaping can decrease the amount of circulation and cause delayed wound healing. We like them to daily eat 1 gram of protein for half of their body weight. When we get more specific closer to surgery, we ask them to do 1 gram of protein for every kilogram of body weight. A daily multivitamin and protein will help with wound healing after the surgery. Staying well hydrated is always important, especially because they will be dehydrated immediately following the surgery. Stopping all blood thinners during surgery, there can be blood loss. Any additional blood thinners that are non-necessary that patients are taking can increase that amount. Not only are blood thinners dangerous during surgery due to blood loss, but after the surgery, it puts patients at a higher risk of having a bleeding incident, which means they can just barely get knocked into or run into a counter and they begin bleeding under their skin, which would require, in most cases, a reoperation to evacuate the pooling blood under the skin, especially if this bleeding won't stop. We also go over their medications, supplements, herbs, vitamins, everything that they take to ensure that they aren't taking any blood thinners. Limiting sun and tanning exposure to the surgical areas. Not only does sun exposure and tanning make the skin have a poorer quality, it also has a effect on the collagen underneath so that skin may loosen more easily and scars may be more noticeable. At least 1 month recovery set aside. That means they're not going on vacation or long trips. They're staying around. If we find out that a patient does have a long trip scheduled, within the first month of surgery, there's a chance we'll cancel depending on what the trip is. At least 2 weeks off of work. This is across the board for almost any surgery. Sometimes we recommend more time off. Within those first 2 weeks, there's the greatest chance of bleeding and clotting, but a DVT or a deep vein thrombosis, which can turn into a PE or pulmonary embolism 50% of the time, which is life-threatening. If patients are planning to lose weight, we suggest that they do it before the surgery for maximum results. If their weight is stable and at an ideal range, usually it's okay to proceed. Any drastic weight loss done immediately before surgery can affect the wound healing and the stretchiness of the skin. If a patient does plan to lose weight before surgery, we recommend that they do it slowly over a few months. If they are planning to lose weight after the surgery, we always caution them that there's a chance that the skin that was tightened, whether it's with breast lift, abdominoplasty, or tummy tuck, any surgery where skin has been tightened, if weight is lost after the surgery, the skin can loosen again. Conversely, if they gain a lot of weight after surgery, that skin can be stretched out and have poor healing quality. We don't like patients to do crash diets before surgery because they will be at a nutritional imbalance. If they're having their well-balanced diet with high nutrition, they're more likely to heal everything much better. We like them to stop if they're taking weight loss pills at least 2 weeks before. Any of the blood work, COVID tests, EKGs, we order at the preoperative appointment, and they're only good for 30 days, so we don't suggest that people get blood work and everything done beforehand unless they're planning to have the surgery within the 30 days. This is the paper given to the patients at their preoperative appointment. We have them continue doing pretty much everything that was on that first paper. You can see that we talk about the walking, the sun exposure, hydration. We give them a list of things to purchase, like a stool softener, which will help because patients after surgery become constipated due to anesthesia, lack of movement, and narcotic pain medication. We suggest that they purchase Tylenol because that is the only pain medication that we recommend after the surgery. Although medications like ibuprofen might be helpful for pain and inflammation, they also have a slight increased chance of blood thinning, whereas Tylenol or acetaminophen do not. We talk about the protein again, the vitamins again. We always suggest that the patient has a thermometer on hand so that they can check their temperature. Having an increased temperature directly after surgery is usually caused by one of two things, or a combination of the two: not drinking enough water or not breathing deeply enough. A few weeks after surgery, if patients are running a temperature, we do worry about infection. We ask that they do not operate motorized vehicles when taking pain medication. We have recommendations for medications, herbs and supplements, and over-the-counter medications. They're always welcome to ask us if they have any questions about that. We talk about smoking and vaping again. We have some recommendations for what to have done or what to have around the house, including cleaning, different foods to have to help decrease nausea, placing items at a level that they can reach without reaching high up or bending down, having ice packs available for those surgeries that ice packs are okay to use, having extra blankets because you can be cold after surgery. A comfortable recliner is sometimes a good idea because we have our patients stay on their backs at an incline for at least 2 weeks after surgery, sometimes up to 4 weeks. We give them all of their required labs, EKGs, testing at this appointment. And so we just have a reminder here to make sure they get that done before the time of surgery. Again, we remind them not to plan any trips, have any events or gatherings, because even hosting a party at your house after you've had surgery can not only stress the surgical site. We suggest that they do not operate any motorized vehicles while taking pain medication, as that does impede their functioning and decision making. Please abide by our recommendations for medications, herbs, supplements, over the counters, and make sure that they ask us if they have any questions about any of that. Again, we talk about smoking and vaping. There's a list of some things that are nice to have done or have around your house for after surgery, some of the things to help with fighting against nausea. Placing all items at hip level so they don't have to reach up or bend down to protect the surgery, having ice packs for those procedures that ice packs are okay to use, extra blankets because anesthesia can give you the chills, a comfortable recliner because we do require our patients to sleep on their back at a slightly inclined level. That's usually for about 2 weeks, sometimes up to 4. All of the labs, EKGs, any testing, we will order at the preoperative appointment, which is this appointment that they get this page. This is just an additional reminder to make sure they get that done before surgery, or surgery can be canceled. Again, no trips, events, gatherings during the recovery period.
Even hosting a party at your house where you think that you're just going to sit there and relax can increase blood pressure, which can cause bleeding. There can always be accidents where you fall down or get knocked into. So the more risky behavior that you participate with in the recovery period, the higher chance that there is that things can go wrong. We always encourage our patients to call the office, and of course, if there's any questions, we make sure to get those answered. There's even a spot here for the patient to sign saying that they agree to follow the instructions before and after surgery, and we always make sure to go over this and see if there's anything that the patient wouldn't be able to do.
More than 2/3 of the population of the United States is considered overweight with a body mass index, or BMI, of greater than 30, or obese with a BMI of greater than 40. Obesity is associated with over 60 chronic diseases. Every state in the United States has an obesity rate above 20%. That's according to the Department of Health in 2021. But never fear, obesity is generally preventable. Balanced nutrition and regular exercise can help reach and maintain a healthy lifestyle. Otherwise, the consequences of packing on the extra pounds can start to impact many aspects of life, including increased risks of complications during or after cosmetic surgery or elective surgery by 30% for an individual with a BMI over 30. Unhealthy lifestyle choices increase risk of complications during or after surgery. My Pre-Hab program educates and encourages patients to be in the best shape possible for surgery to decrease chances of post-operative complication, increase post-surgical outcome, and increase patient and surgeon satisfaction. Dr. Lawrence Chase is the surgeon I work with. He has acted as a mentor to me from the moment I began working at Chase Plastic Surgery 7 years ago. He encouraged me to get my nursing degree and pursue it through to a bachelor's program and beyond. He creates and includes me in learning experiences in the workplace and promotes further study into advancing our practice and improving patient outcomes. My goal for the practicum are to first implement positive changes into a field which can have negative connotations within the community and within healthcare itself. Secondly, foster a feeling of partnership between patients and healthcare providers where they can be equal partners in the veracity with which positive outcomes are strived for. Third, identify barriers to patient compliance, even with the explicit instruction and ample education and time. Sometimes these things can be out of the provider's control and understanding when engaging in only brief interactions with patients preoperatively. The amount of compliance preoperatively can be an indicator of compliance that can be expected postoperatively and may show patients to be poor candidates for elective surgery. In the end, these goals help to decrease complications and increase satisfaction and safety. I implemented my Pre-Hab program at my place of work, Chase Plastic Surgery. Everything flowed about as I expected it would through my project, as it's a smaller office and I've worked there for many years. Therefore, I had a better idea about what I'd be able to implement and the time it would take to create, distribute, and collect results, as this is the practice that I've engaged in many times throughout my nursing career. I was surprised by the resistance some patients had toward participating in a Pre-Hab program, as they view cosmetic surgery as a quick fix and want to put the least amount of effort in possible. Unfortunately, this is not how any form of healthcare excels or is safest. This left some patients disappointed by the effort expected of them. Dr. Chase is in a unique position of working in private practice, which means he owns the practice and he can refuse to perform surgery on anyone. And in most cases, non-compliant patients are refunded their money and recommended to make lifestyle changes before proceeding with elective surgery. Dr. Chase and the rest of the staff have office meetings once a month, and at the first meeting of the semester, I proposed the implementation of a Pre-Hab program. Already, I had printed off articles for the doctor and staff to refer to, making claims about the benefits of this particular program for our office. They all agreed this is a good idea, and I created a hard copy for the initial instructions for our patients, which was approved by Dr. Chase and the other nurses who work at the office. They suggested I update our other paperwork to flow more seamlessly with this new program, and I set to work making necessary changes and updates to the current paperwork. This was time consuming, but I was able to get a number of patients started with the Pre-Hab program while I worked on the rest of the paperwork. The goals of my project were met by successfully implementing a Pre-Hab program to patients about to undergo surgery with their signed consent and confirmation of willingness and ability to comply with the requirements. Education helped our patients to take this step towards surgery seriously and with the proper thought and consideration. Patients who diligently followed written and verbal instruction and recommendations felt they were more in control of their surgical outcomes rather than just relying on the medical staff. They had an active and defined role in their own care. Lastly, many barriers were identified through the collaboration with our surgeon and other staff in partnership with our patients. In some cases, the breakdown of specific instructions rooted out the problem of non-compliance, and sometimes it was just a matter of reinforcing the seriousness and importance of following recommendations. In a few cases, patients flat out refused to follow specific instructions and unfortunately paid the price. Some were lucky and complications didn't arise. Unfortunately, then this leads to a confirmation bias that they didn't need to follow the instructions anyway, since nothing bad happened to them, and they will spread this false information to other patients, which can be damaging, as most of our business is word of mouth, and patient expectations will be falsely created by their friends and family's narratives. In our office, we saw benefits from this program, which were higher patient satisfaction because they felt they had participated in their surgical journey and were able to come out more knowledgeable about their own health and body. Better communication not only between staff and patients, but between staff themselves as we discussed what was working and what needed adjustments throughout this process. More trust between healthcare providers and patients because patients felt like they were being told information straightforward without being sugar-coated. Due to their increased knowledge from nurse education and implementation, they were able to understand and communicate specific wants and expectations for surgery, while keeping a realistic goal in mind. More positive surgical outcomes and fewer post-operative complications were achieved when patients followed instructions. If instructions were not followed and complications occurred, patients were more understanding because they were fully informed of the consequences of their actions or inactions. All patients are informed of unavoidable complications that can arise even if the chances are small. The professional benefits I experienced for my own growth included a greater understanding of patient surgical process from the eyes and mindset of someone about to have surgery. Because I took the time to evaluate patients after they had surgery and ask them more specifically about their pre-operative learning and preparation, I got a unique glimpse into the mind and methods of patients making decisions about surgery and what they decided was important and what they actually remembered from all of the information given to them. By utilizing a combination of repetition and creativity in an educational process to get information to stick with a patient, I had the frustration and excitement of finding out what works for one does not work for another, and personalization in healthcare is a must. One size does not fit all. Most importantly, I had the opportunity to be a leader and innovator in my practice. Not only did I come up with ideas, but I listened to the ideas of patients, coworkers, and my preceptor to create the best system possible for giving information and implementing this Pre-Hab program. Being a leader does not mean telling people what to do. It means inspiring people to work toward a common goal and achieve it. My project promotes health for preoperative patients in order to avoid or lessen postoperative complications and increase satisfaction and positive outcomes. Using a mixture of verbal and written information, repeated and encouraged to be read again at home, ideally 5 times before the patient actually had surgery. But this requires work not only on the side of the office staff, but on the side of the patient, which was one of my goals in this project. To dissolve the idea of a healthcare team treating a patient in a one-sided relationship. Instead, we created a healthcare cooperative, including the patient, to actively and passively work towards a common goal of successful, satisfactory surgery. In the future, I will be using this model of teaching and cooperation between patient, surgeon, nurses, and other staff to create rapport and trust. So this is not a dictatorship, but a joint effort at reaching objectives. Yes, we may be the professionals and patients come to us with a certain amount of blind trust, but that does not mean we treat them as if they have no part to play in the achievement of their health. Whether it's surgery or disease management or treatment, the future of medicine needs to be individualized and it needs to be a collaborative, which includes patient responsibility. Thank you for listening to my presentation. Good luck with all of your presentations.